Management of injury. Today's topic is management of injury. Shock phase আগের দিন যা বলা হয়েছিল এগুলো 24 to 48 hours. Hypothermia, reduced cardiac output, lactic acid reduce. Shock phase aimed at conserving energy. Early shock phase 24 to 48 hours. Hypothermia, reduced cardiac output and hypothermia. This is the pathway where the metabolic response occurs. From brain, there is a pituitary, then ACTH, then adrenal gland, pancreas injury থেকে leukin, interleukin 4, tumor necrosing factor. Resuscitation is the main part. After diagnosis, proper resuscitation will occur, and according to the emergency, if not resuscitated properly, patient may die. Flow phase, days to week. Patient when it is recovering, anabolic element occurs so that the tissue repair properly. Amino acid from the liver, acute phase protein, hyperglycemia due to the lipolysis to store energy and tissue repair. Anabolic phase, recovery occur late as the patient recovers. Metabolism occur for conserving increased energy need. Catabolic element, hyperglycemia, acute anabolic phase, mediator, this is the mediator, interleukin 1, interleukin 6, tumor necrosing factor. Then today's good morning. Then come to the, according to the tissue injury, according to the diagnosis, you will manage accordingly. If it is operative, is only stitch, whether chest injury, operative chest injury. Cadaveric oath, you have got all cadaveric oath. The difficult operation should learn from cadaver, not from you and me. Number 1. Number 2, you have to learn it from assisting the operating surgeon. That's difficult by the other. Whichever difficult operation should be done first in cadaver, so that during the living subject, the diagnosis will and management and treatment operation will be properly. Then this is the surgery. Before 1600 BC, Sushruta, great Indian surgeon from Benares, he do some surgery. He is the father of surgery. Mainly he have done the different sorts of plastic surgery. He is doing some sorts of plastic surgery. This is Sushruta. In that time, there is no anesthetic system. Patient will be supported by the patient so that cannot move properly, and operation can be done accordingly. Management, resuscitation, supportive medicine, infection control by antibiotic and also toxoid, surgical intervention, early nutrition to prevent excessive catabolism. During that, there is a protocol. During the management of a patient, early oral feeding should start as early as possible according to the need of patient and need of management. Key strategy include controlling hyperglycemia, providing enhanced recovery protocol. During surgery, there is a enhanced recovery after surgery protocol to reduce stress and promote anabolism. Core pillar of ERAS, enhanced protocol. Pre-operative, যেগুলো বললাম, whatever is the patient educated what to do. Counseling, smoking, alcohol cessation, metabolic optimization, carbohydrate loading up to 2 hours before surgery, intra-operative, minimal invasive surgery, standard anesthesia, and to maintain euvolemia and prevention of hypothermia. So, hypothermia will not occur and patient will be no pain and also be fluid balance. There should not be a overload of the fluid. Post-operative. In post-operative, there is a protocol, early mobilization as far as possible. Not at the sake of operation, but it is sake of the patient. If patient able to early mobilization, early oral food, early removal of the optimized fluid passing to maintain euvolemia and prevent hypothermia, early removal of drain and catheter, and early oral feeding, early mobilization, and standardized non-opioid management prevent ERAS. Non-opioid substance দিলে ইলিয়াস হয়, so non-opioid analgesia দিয়ে তাদের, এবং short acting. When operation will be over, the anesthesia also. Phase approach, Ebb phase focused on the restore blood volume. Next ক্লাসটা তোমাদের আছে কোয়াগুলেশন উপর আছে, তাই তো? এই কোয়াগুলেশন ফ্যাক্টরটা যদি দেখো যারা খুব ব্লিডিং ডাক্তারবাবু রক্ত বন্ধ আছে, তখন তার জিজ্ঞেস করে নিতে হবে whether patient is able to control his bleeding previously. If the history is there is a no bleeding will be long one, you have to diagnose. There is a bleeding diathesis and you have to diagnose what is the bleeding. If there is no remedy available, in that pressure bandage will be done, and there is a protocol of the pressure bandage so that the limb cannot be sheared. To page days 3 to 10, aim to manage the hypermetabolic state which involve increased protein breakdown and insulin resistance. For insulin resistance, Metformin is a standard drug that can be used so that the tissue can properly utilize the expenditure by the help of that drug. Nutrition support, early essential to counter early internal need is preferred to support gut. If there is a GI tract disease, patient is able to take the food, then the normal diet or according to need. If patient not able to take, there is a GI surgery. In that situation, if necessary, the parenteral nutrition, given source of parenteral, that can be helpful. Metabolic insulin therapy is required. Pharmacology, potential use of anabolic agent, growth measurement to reduce nitrogen loss. Environment of surgical care, pain management is the main factor. If the pain of the management not done properly, the tissue will not heal properly. Temperature, in the operation should be done in normal temperature or AC temperature. The temperature will be 28 to 30 degree. If it is low, above that temperature, patient will be harmful. If it is below, it is also be harmful, both way. Early surgical, when it is required, you should do the surgery, not delay. In case of burn, debridement. Debridement of burn wound or reduction of fracture decrease the source of inflammation. If the managed property, set inflammation will reduce and the tissue heal properly and patient go home early. Key phase of goal, reducing muscle wasting, management fluid balance, suppressing inflammation, targeting mediated like tumor necrosis factor, nuclear factor, kappa B, this should be reduced. Tumor necrosis factor, it is also, if it is potas massively, the tissue recover not properly. There is some inhibitor IV allowing it to enter the nucleus and trigger excessive. Support, early parenteral nutrition, high protein intake. In case of burn, there is a increase, it may be 1.5 to 2 gram per kg per day. From normal diet, it will increase. Carbohydrate properly so that glucose dependent tissue like healing wound. Immunonutrition, supplementary glutamine, omega-3 fatty acid, antioxidants should be done. Pharmacological support, beta blockers, sometimes it is helpful to reduce heart rate, and insulin therapy, anabolic agent, oxygen may be given. Metformin and an alternative to glucose control that carries a low risk of hypoglycemia compared to insulin and may improve insulin sensitivity. Metformin is a good drug. Due to, if it is in patient is in insulin therapy, there is hypoglycemia, but metformin will not do this source of insulin. So preferred medicine is metformin. Environment, surgical care, temperature should be 28 to 30 degrees Celsius. Minimum illness in surgery, as minimum as possible. If it is laparoscopy, to laparoscopy so that tissue insult less. Effective pain control, early wound closure. As much as possible, it should be early. As much as early possible in case of burn, debridement and skin grafting, so that the tissue cannot react in inflammatory cascade. Physical reaction after proper management, there is a physical readjustment, so that patient can come to the normal day-to-day. Speak dosage recommendation for anabolic agent for the biochemical mechanism and proper antibiotic if necessary. First it is empirical antibiotic, then come to the culture sensitivity. If it is culture sensitivity, drug should be employed.